Good morning, everyone. My name is Shayma Kazmi. I'm a medical director of thoracic oncology at Cancer Treatment Centers of America. But I'm here today talking about a very different topic. I think a topic that has consumed us for over a year, and we really do need to start talking about it more openly. It's merging into another topic that's close to my heart about redefining work-life balance. But how do we do that in the wake of the biggest pandemic, or really the only pandemic in our lifetime that's affected us? So let's talk a little bit about what it means to talk about work-life balance, right? I'm a big proponent of making sure that we're all speaking the same language. So Cambridge Dictionary defines work-life balance as the amount of time you spend doing your job compared with the amount of time you spend with your family and doing things that you enjoy. So that's really how it's defined. But let's talk a little bit more about how it relates to physicians. My entire career, we have sort of aspired to the 3 A's of physician excellence, right? It's able, affable, and available. So the available part completely flies in the face of this whole balance paradigm. You know, the typical physician duties that we all have include patient contact, administrative tasks, charting, teaching, meetings, and community outreach activities. And then when you add mobile technology, such as your laptops and your cell phones, that means that work time easily creeps into your lifetime. So where is that line? How do you distinguish between work and life? And how do we spend that time outside of work? Most of us, of course, we need sleep, nutrition. We all need exercise, but a lot of us probably don't get it. Spiritual pursuits are important, and interactions with family and friends. So those are the things that we either really need or really do enjoy, that we consider our life outside of work. But we don't consider the mundane stuff a lot, you know, meeting your household needs, going grocery shopping, shopping for clothes, shopping for household things, home improvement projects, laundry, cleaning, bill paying, and then showing up for kids' activities, remembering to sign them up for it, and tending to sick family and friends. So that's also important life stuff that we wouldn't necessarily say we enjoy, but it's really important and it defines who we are. And so when we talk about this, there are people who really feel strongly that the word balance is unattainable, and that by sort of having the separation of work and life and balance, we're creating a conflict. That's an opinion. And that folks believe that integration of work and life is more realistic. No matter which side of the argument you're on, we all do need to figure out how we achieve this balance or integration, however you want to look at it. And I personally think that what's helped me and continues to help me, because you never really get there, you're constantly evolving, is to identify a purpose and a vision. You know, we do that pretty well, I think, in our academic life, in our professional life. You know, we want to work here, we want to go into administration, we want to be full professor, whatever pursuits may be. I think we do a fair enough job defining that purpose and vision professionally. And maybe we don't, some of us, and we need to sit down every couple of years and figure that out. But really don't do a great job in doing that with our personal life. What is our purpose as it relates to our family or friends or community? And what's our vision of life outside of work when we are done working or semi-retired? And so I think that requires a certain degree of goal setting. Most of us are type A and we like goals and little to-do lists and checking off. But goal settings for the long term, for the next year, for the next 2 years, for the next 5 years, requires a sense of prioritization, because unfortunately we all only have 24 hours and at least 8 of it should be spent sleeping. So that leaves us with not a lot of time in every day. And while certain things have to get done, we have even less time to do the things we want to do, to maybe engage in a different degree, maybe to do more volunteer work, to create an organization or a trust or whatever it is that we want to do requires a sense of prioritization, which then leads to goal setting. And then really this idea of intentional living is something I'm really excited about, because we all go through our days as just sort of this hamster in a wheel. Get up, go to work, do our things, make dinner, get the kids homework done, get the house clean, and you sort of off to bed. And then, so in the short-term goals, we kind of lose this idea of intentional living, this idea that every day is one less day we have in our life. And it's very, very precious. And we don't want to have to realize that when we're 70, 80, 90. We want to realize it now and not sort of just be a hamster in a wheel, and really make a decision every day on how we're going to spend every minute of every day. And that doesn't necessarily require doing things. Even taking a step back, meditating, reflecting, having quiet time is super, super important in this crazy life we live. So how does it relate to the COVID-19 pandemic? In the beginning, when it began in March, I remember March 16, 2020, my kids stopped going to school. And to me, that was a milestone. Something big and bad was happening, because that had never happened before. And all of a sudden, what do? The children stopped going to school. We stopped seeing friends and family. We stopped vacationing, of course, stopped going out to restaurants. They were all shut down, museums, parties, all of that stopped. And a lot of our friends and family stopped working. They had this whole work from home. And you said, wait a minute, we didn't stop much of anything. Some of us maybe had some telehealth and transitioned a little bit. But for most physicians, especially the frontline physicians, work was even harder. Work was scarier. Work was tougher. They were really, really understaffed. And so for most doctors, work went on. Everything else shut down that brought us joy, but the work piece of it went on, and maybe it was even harder, I would argue. So as the pandemic continued, the physicians who performed procedures were out of work for a while. All of the elective procedures were shut down for about 3 months in most states. And that was a huge financial stressor for a lot of docs who had never anticipated something like that. None of us had. I know that a lot of, as it went on, a lot of physicians took significant pay cuts, as well as a lot of practices shut down. So this was very, very stressful financially as well. The one good thing was telehealth was adopted quickly and successfully across many specialties. And I think for all the right reasons, it should stay for a lot of us. Children are home, though, requiring hands-on schooling. If you've seen this chart, we all went in with this grandiose ideas of we're going to make these beautiful charts, and they're going to do chores and exercise, and certain times of the day there are going to be different reminders and Zoom calls and snack times. And I don't know about you, but it fell apart really quickly in my house. All of those charts disappeared. We had good ideas, though. And then we changed into scrubs, and some of my ER colleagues were really actually changing and getting showered or getting hosed down before they walked into the home, with real serious fears of infecting families, and families were infected. We spent a lot of time at home, and we baked a lot of bread. Who baked bread, right? We all did, and then we ate it, unfortunately. We did a lot of cooking, and all these, social media really blew up with sort of home cooking recipes, and homeschooling for me had to be the toughest, I think, at the end of the day. It was frustrating. It was hard just to be in each other's faces a lot more than we had anticipated. As it continued, a lot of physicians we talked about lost jobs. Some got sick, and a lot of colleagues we know died from the epidemic. So this was a huge hit. Fear was rampant. Doctors were heroes initially, though. We were terrified, but we got cheered and applauded as patients recovered. But we lost the ability to hug, touch, and comfort our patients, especially in oncology. That was such a big deal for me. But soon, however, this whole us into heroes turned into us against them. We're doing it for the money. Anti-vaxxer propaganda really blew up and included doctors as part of the conspiracy. and we got exhausted. We've been exhausted. And so where are we now, 1 year later? These masks are now optional. More than 50% of the US population is fully vaccinated. I think I saw the number yesterday, 61% had at least one dose. And with COVID vaccine, it's a game changer. Telehealth is declining, but we have questions about ongoing payments for telehealth. The workday is becoming more normal for us. We're going back into the office, seeing patients and clinics are full as usual. Children have started to go back to school, although now it's summer, so they're going to be back home again, or camps. But what we didn't anticipate is this cancer shadow curve. It's really, really important to notice, since March 2020, there has been a significant effect on treatments in cancer patients because of the pandemic. So 50% of cancer patients said their treatments had been affected. You know it. I know it. We had to cancel treatments. Patients were too afraid to come in. They certainly declined visits related to specific cancers. So 94% breast cancer, 86% colon, and 94% cervical cancer patient visits declined because of the pandemic. And screenings, 90% colonoscopies, those were elective procedures. They didn't even happen for a while. 87% of mammograms and then 83% of pap smears were not done. So based on this, the NCI predicts in excess of 10,000 additional deaths from breast and colorectal cancers in the next 10 years due to screening and treatment delays caused by the pandemics. Not to mention, a lot of us in academics, you have 80% of US cancer researchers surveyed that says that COVID-19 has massively disrupted the clinical trials. 60% are enrolling trial patients at a lower rate, 20% not enrolling at all, and 20% luckily at the same rate. And so 80,000 patients are at risk of delayed diagnoses. So in our oncology world, we're going to see the aftermath of COVID-19 for years to come. So where are we now? US accounts for 25% of the world's known COVID cases, with nearly 25 million identified here and more than 500,000 Americans dead. In fact, I think yesterday alone, the number reached 600,000, which is just a lot of people who've succumbed to this horrible pandemic. There's a tsunami of grief where every person who dies of COVID leaves 9 others grieving for their loss. So there's a ton of grief to go around. Thousands who have recovered from their infections are living with ongoing symptoms, and they don't know when these will go away, when they may get better, or what's going to cause them long-term health sequelae. The pandemic has really widened the racial and economic fault lines. Blacks, Latinos, and Native Americans are 4 times as likely as whites to be hospitalized from COVID, and twice as likely to die from it. And this is from the CDC. But really, more importantly, where do we go from here? What does this recovery look like? COVID is life-changing, not just for you and me and our patients and people who've had it, but for the planet as a whole. We know that minor work pivots force our lives into new paths. So as we talk about work-life balance, a lot of us who started working from home, who started working from home a little bit, have recognized what we were missing. And I know that a lot of my colleagues have decided to have to go either part-time or try to find ways to work from home at least part of the time. So that's called social role adaptation. For some of us, we realize that being home is really not great for us. We need to be outside of the house. But these are the pivots. These are forced changes in our life, and that's made us rethink what we really value and what's most important. Our older children may have missed opportunities that can echo for years. So this doesn't just affect us. Children who missed their athletic scouts and they were hoping to get athletic scholarships, sports scholarships, may have missed out. They may have missed out on academic achievements. Younger children may have lost critical educational building blocks. I know mine have suffered from all of those. And then don't forget mental illness. 40% of Americans have mental illness that is worsened along with drug abuse due to isolation, this economic uncertainty and fear. And children missed 9 million vaccinations last year alone, part of the Blue Cross Blue Shield data. So you can imagine what kind of other illnesses await us in the next year or so because of these missed vaccinations. So when you really talk about it all, I don't mean to be all grim. and scary, but I'll tell you what I will keep from the pandemic. I know that this is something different for everyone, and everyone has experienced this very differently. What I really think was important to me, and I never really forcefully enjoyed it, this time with family, this really forced time with children, being able to cook together, being able to play video games with them, to know what really makes them tick, or board games with us because we like that better, to be able to really be together, and home cooking. We used to order out a lot, and we love still going out to restaurants. Don't get me wrong, I love that. But really be able to teach our children and the next generation the value of cooking and healthy foods, and virtual conferences. I really love the idea, of virtual conferences, at least as a hybrid. They don't all have to be virtual. There's really important thing with actually, mingling with other humans in person, and really networking that way. But I think there's a role for people who can't get away, and really need to benefit from those conferences. And then this option of telehealth, and payments for remote work, I think they should really, really consider keeping that for at least certain specialties like psychiatry, where physical exams are really not necessary. But even some follow-ups can be done with telehealth, which can really help patients. It can help physicians. And then this idea of separating work and living space, when we talk about balance and separation, we all started sort of working in our beds, in our bedrooms, and I thought that that's something I'm not going to do, and to create a separate space in your home, that is dedicated to work if you need to do work at home, to make the mental separation. And really, at the end of the day, I have just a ton of gratitude, for what we've overcome, as a country, as a people, that we continue to overcome. I mean, we're not there yet, but what we have just come together to do with the vaccine, I am grateful to science and really all amazing, smart people out there who've really done this. And I'm grateful to everyone who has really given their life, and really taught us an important lesson about appreciating ours. So thank you very much. And I'm happy to take any questions that you may have.